Welcome to Health Matters on Channels Television. It's great to be with you. I am Mary Alale Yusuf. Any injury to the teeth is its supporting hard structures, gums, and nearby soft tissues like the lips and tongue can be referred to as dental trauma. Trauma can be described as a wound or shock produced by violence or accident. Dental trauma is a commonly occurring feature in children between the ages of 7 and 10, but can actually happen to anyone at any age. It may result in fracture, displacement, or loss of teeth. According to the World Health Organization, the global prevalence of dental trauma in both primary and permanent teeth is about 20%. There's a consultant pediatric dentist with me in the studio, Dr. Aderunke Oluwo, works at Mercy Street Children's Hospital in Lagos Island. You're welcome to the show.
Thank you very much, Mary.
Well, obviously, trauma to the teeth will be painful.
Yes.
But are there other things, other symptoms of tooth trauma?
Apart from the pain, first thing, that's usually what the patient actually presents with. But if it stays for too long, one of the things we have is patient presents with swelling. Usually there's associated inflammation for the first few hours. And then if it lingers for that long, there's an infection already going on, and then you have abscess. Sometimes you have cellulitis developing, and so on.
Can somebody maybe fall down the stairs, break the teeth, and be okay without going to the dentist? Because I can imagine that people will just say, oh, it'll pass, it's just a fall. Okay,
so one of the major causes of dental trauma is falls. In our environment, if I have to classify it, in children, infants to about age 3 that are home, and then also in school children, preschoolers, and within older ages. Now, for children less than 3 years old that are at home, gone were the days when we used to use carpet and rugs in our homes. Now we use tiles, hard floor. Now you have a child hitting his mouth on the floor. On the staircase, too, don't forget that most of the floor, staircases are also tiled. It could be just a slip. And then because the orofacial region, most times when you fall with your head forward, the teeth are actually very prominent, and usually they fall with their mouth open. And that's why most children come down with fractures, dental fractures,
especially
or lacerations.
Those ones who have protruding teeth.
Protruding teeth, that's one of the actually predisposing factors to it. Once you have a child that has prognatic facial structure, you have that.
Accidents also and all that?
Accidents, yes, contact sports, things like accident-prone events, like things, usually boys, but now we have girls also in those kind of contact sport. Then you have collisions, then you have road traffic accidents too. Children falling. Now we have a lot of children. You see a mother carrying a child on a bike.
Yes.
You know, things that we could actually avoid.
Sometimes on the back too.
On the back, yes. So usually when you have falls, collisions, assaults will also come. And sometimes it could actually be at home. Abuse, child abuse can actually be one of them. And then children have seizure disorders where they go into epilepsy. Yes.
That can affect the teeth? How? Why?
Falls, because they fall and then
they fall. But not because they shake and bite and all that stuff.
Usually you don't have them biting so hard because it's always because of a fall that you have such accidents.
Can something like hard food or bones cause it?
When you chew on stone, in this environment,
a lot of people find their beans.
But it's not common in children to have such accidents. Okay. You don't have a child, I don't get to hear of that.
Okay, so let's say somebody falls and has a partial break in the teeth.
Yes.
Maybe the bottom of the teeth. When I say bottom, because I know you people have your own language, when I say bottom, I mean the part that is further from the gum. So it breaks, so it's like it has half a tooth left.
Yes.
Can you restore that to look normal?
Okay, so let me classify it for you. Now, fractures can present in different ways. We have different ways of classifying.
That's a fracture, right?
That's a fracture, yes.
Not a breakage?
That's a layman's term. When you call it breakage.
So they're the same thing?
It's fracture, tooth fracture. So you could have just enamel fracture. You could have enamel and dentin without the pulp exposed.
Okay.
You could have the enamel and dentin with the pulp exposed.
So what you're doing now is, figuratively in our minds, you have sliced the tooth,
yes,
and we're looking at the layers.
Exactly. So when you have, usually is when you have exposure, that there's always a problem. Now, that we have pulpal exposure, then if even sometimes...
Before we go on, okay, I'm really interested in this tooth. If you can just look there on the screen.
Oh, okay.
What kind of displacement is that? The person is born that way, or he had a fall?
No, this was a road traffic accident, and this is a dentoalveolar fracture.
All right.
Meaning that the bone, not just the tooth alone, the bone is also affected. You can see that the whole tooth is as if it's completely displaced from the arch. And then if you look carefully, you know, the supporting structures are also not intact. That's the gum.
It's been knocked out.
It's been knocked out, yes.
Well, so go on about...
Okay, so sometimes you also don't have the teeth fractured. You could have a root fracture. Without the roots are inside the gum, so you won't see it.
So it's under where you're not seeing it.
So you could have a root fracture without crown fracture. But whichever way it presents, we always tell people to seek the counsel of a dentist immediately. Now, one of the things that happens is you could have, if you have a fracture, just a simple fracture like an enamel fracture, a dentist will just, if it's not complicated, there's no other issue, a dentist will restore for you. But once it starts going into pulpal exposure, or the blood vessels are truncated, that's within the bone now, you will have the tooth, I'll put it, it's called necrosis, as the tooth becomes non-vital.
Yeah. It dies.
It dies, yes.
Okay. Now, here's where I really have a question for you. The pulp is a living thing, right? It has nerves, blood is flowing. But is the tooth a living thing? Isn't it a dead piece of material?
No, the tooth is not dead. You have already
it's
said
alive.
Yes, because you have already said the pulp. Because the tooth, the tooth is made up of a crown and the root. The pulp is within the crown and the root. So the tooth is alive.
But if you take out that pulp?
If you take out the pulp, then that means you're going to put like a filling, then it's more like, in layman term, I'll put it more like a container. Okay. But you need to maintain, don't forget that the reason why you have your teeth in place is, apart from aesthetics, you need it for speech, you need it for mastication.
That's right.
And then that affects your physical well-being, your mental well-being. Some people can't smile just because they feel that their teeth are not.
Yeah, I can understand that people will feel somehow, they feel some type of way, smiling if they have fractures in their teeth. But a child of 7, 8, does it affect that child?
Yes.
Remember that he's going to lose all those teeth anyway at 6 or 7.
Okay.
And have that gap tooth smile. Okay,
so I'll tell you that at 6, the tooth that most likely fractured are permanent dentition. It's part of permanent dentition. Okay. It's not the primary teeth. But if it's a primary teeth here, most times we extract it. We don't reimplant it. We just extract it for the child.
So you treat with primary teeth differently from
permanent
ones?
Yes. Now, don't forget that these children are in schools. Their classmates laugh at them. Sometimes when they smile, they'll tell you in clinic that they don't open their mouth because they feel that their friends will laugh at them because they have, some of them will say Dracula teeth. They call it all sorts of names.
Even a child?
Yes, a child. And they are the ones that their psychology is actually affected. So most times we tell the parents to always, but sometimes we parents are funny. We don't take it very seriously and we leave it for years. And then now we see adults coming, and sometimes when an adult smiles, you're looking at the person and it has a broken teeth. Or sometimes one tooth is discolored, meaning that tooth is, in literal terms, now dead.
It's necrosed.
It's necrosed, like yes. So, and then they wait until there's an infection, there's pain, there's swelling, and they come to you. Now, usually when we are taking our history, we ask them the question, when did this happen? They tell you maybe like 20 years ago, when they were in secondary school.
It can.
Yes, it can. But of course, it's going to be discolored. It could form pathology under within the bone now, without anybody noticing. Could you have it cysts? You could have a granuloma. You could have different things.
Okay, this sounds to me like if somebody has a fall
Yes.
Whether you notice whether there's anything wrong or not, you should see the
You
dentist.
should seek a counsel of a dentist.
Because something could be going on in there.
Sometimes the tooth may be mobile without you knowing. If it's a root fracture, you wouldn't know. But you may just notice that there's a bit of mobility. And sometimes it could be luxated, meaning it's displaced. And it could actually just be there, but you need to be sure of what is wrong without just saying you're leaving it like that. And sometimes just be very mild without any sequelae. But usually what we tell, particularly in schools, we get that a lot of times when a teacher comes and they says, oh, he had a fall some time back, and then they thought it was just normal, and then suddenly the boy comes with pain, and they think it's something else.
That pain can last for 2 weeks.
Dental pain can be very, 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 very
It knocks you out. You can't concentrate.
Yes. And then, for a child, it's something else. Usually when they come to clinic, you are treating both the mother and the child, because even the mother herself is actually
distraught.
She's wondering what exactly is this. She doesn't know that it's actually because of a fall that happened. And so we normally encourage people, particularly those in contact sports, to be careful. If you can get a mouth guard, we don't mind when you're doing that. Then for people that engage in accident-prone events, adventures, people that go climbing on trees or wall, some scale down the staircase like that, and you really have to tell them that once that tooth is fractured, there's nothing as you having your own natural teeth. Once the tooth is fractured, we are restoring with artificial
yes, but
fillings.
Can it do the same sort of thing?
No, it can't. It depends on the level of fracture. If it's just that we are using a composite to fill it, we normally tell them that you can't bite on something very hard like, let's say, corn, roasted corn. It could knock it off. But if it's a crown, yes, that's a permanent filling. But don't forget that these children are growing. So most times what we do in children is that we use composite. That's a restorative filling we use, because we wait until they're of age before we put a permanent restoration. And then the children have to see us within every 2 years just to check if the restoration is in place.
What happens if somebody's tooth is completely knocked out?
Okay.
Can you put it back?
That's avulsion. Avulsion actually is it's an emergency, it's a dental emergency. Something that happens when it usually happens at home or in school. When the tooth comes out completely, what we tell people is if it happens within the first 10 to 20 minutes, there's a better chance of survival than if you leave it for the next day or the following or 2 weeks later to see the dentist. So what we tell parents is once the tooth comes out, or the teacher in school, once the tooth comes out, if it falls just in the mouth, and the boy, it's not like came out or not, it can be put back and tell the boy to bite on an handkerchief.
By themselves?
Yes, bite on the handkerchief and get to the nearest dentist.
Okay.
Now, if it falls somewhere that it's not in a dirty environment, don't pick by the root. You pick the crown.
That's the white part?
The white part, yes. And your implant, bite and get the patient to the hospital.
How about
if it's now in a dead... Sorry?
How about rinsing it,
You can't, water is out of it. You destroy the remaining periodontal ligaments around that root.
So don't rinse with water?
So don't rinse with water. Usually what we tell them, so if you can have a storage, either milk or saline, once you can put it, and you can, just a storage for you to get to a dentist. Okay. But all that should be less than an hour.
Milk or saline?
Yes.
Saline, that's salt water?
Yes. Okay. Now, if you can get that, if you can't get that, sometimes we say put it in the buccal mucosa. That's in the cheek now,
English?
Sorry. In the cheek. And then tell them to bring. It's safer, but get down to the nearest dentist. You have a chance of survival.
Milk or saline water, any particular temperature?
No. We have usually, don't forget, it happens in school. You don't have time to start looking for.
Just be
it's just something for you to hold so that the cells don't die off.
So it really is alive.
Yes, until you get to a dentist and they reimplant it for you and hold it, splint it back.
How long does the person have to get this thing done before you get to say, this tooth is dead, we can't use it anymore?
Oh,
We'll answer that after the break.
Okay.
We'll go on a very short break. Please stay with us. We'll be right back. Welcome back. If you have questions to ask about teeth and their injury to teeth, the number to call is 0808-054-2233. That's 0808-054-2233. You can also tweet at CTV_Mary A while we learn about injury to teeth. So, we were talking about, storing the teeth and everything, and I was asking you, how long can that tooth live if it's properly treated? Put inside saline water before you go to the hospital, or inside milk or something like that?
It's your natural teeth. The chance of survival depends on the time of presentation.
Okay.
If the patient gets to the hospital within 90 minutes of occurrence, you have a better chance than someone that comes after 24 hours or after 3 days. Of course, by then, all the cells would have been gone, so we don't even reimplant at that stage. We tell the patients. But usually when they come within the first, like 1 to 2 hours, we're able to do a better job.
Okay, so the earlier the better.
The earlier the better, yes.
Some children say that, their tooth is shaking in the socket. And by the time they get to the dentist, the thing is firm. And mothers are like, no, this child wanted to cut class. Does that thing happen, that it can shake and then it can get firm?
Once there's trauma to, particularly the upper centrals, when there was trauma, because it's most prominent in the mouth. So the first thing that happens is you have a bit of concussion. Okay,
let me quickly pick this call from David, and then we'll come back to that. Hello, David.
Yeah, good afternoon.
Good afternoon. What's your question?
Yeah, I want to ask, good afternoon.
Go ahead.
Yeah, I want to ask a question from the doctor.
Go ahead.
I have somebody, like when he drinks cold water or hot food, he complains very sharp, at the side of the teeth. So I want to know what can be the remedy now, or what can the person just do?
Okay, doctor, over to you. I know this is not the trauma that we are talking, the type of trauma we're talking about.
In fact, I think my answer to the question is to go to a dentist.
Oh, not just stop taking cold things.
Because you don't know what is happening. You don't know why it's feeling sensitivity. You don't know what the reaction is. I don't know if it's following trauma or something else, but what I can tell the person is that you have to get to a dentist, because once you start feeling sensitivity, that means the dentin is affected. Okay. And it may or may not affect the pulp. Once your pulp is affected, then infection starts. And then that means you are going to...
So all this sensitivity that people are carrying around is actually a time bomb in some of them?
In some of them, yes. But once you get to your dentist should be able to tell you what exactly is happening and what you should do and what they would do for you in the clinic.
If someone has a hairline crack in the tooth, it's just cracked, it hasn't fallen down, what do you do? But let's take this call from Olugbo first. Hello, Olugbo.
Hello?
Olugbo. Hello.
Yeah.
Can we have your question?
I want to ask the consultant a question. Hello?
Hello, go ahead, go ahead.
Thank you very much. Please, I'm a grandma, and my granddaughter is under 3. And can you hear me?
Yes.
My granddaughter is under 3. And they live outside Nigeria. And I was called 2 days ago that she's going to undergo surgery because she's lost. She's going to undergo a surgery because.
Go ahead, we can hear you.
Because 4 of her teeth she needs to remove 4 of her teeth. How safe it is? Is it for a child that is under 3 to undergo surgery? Please.
Okay, thank you very much, Olugbon. They need to take out 4 teeth. Why would that be happening to a 3-year-old child?
There are different reasons, but I think I don't know what in their own case what the problem is. But if a dentist should decide to extract 4 teeth, that means that there's no way of restoring those particular teeth.
Could it be a case of overcrowding at that age?
No. At 3, well, except if the child has extra teeth. Let's put it that way. It's possible. But if they are I'm certain that the reason they are taking that chance and they want to do a surgery is because it's either most times the teeth can't be restored. And I think a dentist should take that kind of decision. He or she should know what is doing.
Well, she said they're not in the country. Would you advise Olugbon at that point to maybe get a photo of the grandchild's teeth and seek a second opinion, maybe?
Well, you could seek a second opinion, but don't forget that they can't present a clinical... A picture can't give you a clinical
yes, diagnosis, yes.
So you have to see the patient directly. But if the child is with a dentist, I can assure that the child is safe.
Okay, let's take this from Halima. Hello, Halima.
Hello, good morning, madam.
Good morning. What's your question?
My question is, I'm a grandma, and I don't know how I lost 2 molar. They are not out. They are broken for the past 6 months. And right now, nothing is happening to me because I'm still using my Sensodyne. I've started using Sensodyne since I was a student in England in 1964. And I've been using it up till now. So I'm not feeling any pain, but I keep biting my jaw, the cheeks. Each time I eat, I lost the molar and the premolar on the right, and then the molar on the left. But I'm now 65 years old. Please, what can I do? And I'm scared to go and remove it.
Okay, thank you very much. Now, before you answer that, a dentist was here and told us that no matter what kind of measure you use, it's temporary until you see a dentist.
Yes.
Okay, so with that in mind, what does Grandma Halima do?
Grandma has been using Sensodyne since 1960-something. I'm guessing...
That's forever.
Exactly. And in those
times... But don't mention the brand name.
Okay, so...
No more brand names.
Okay, so if she has broken teeth, as she calls it, it could be that those teeth have been curious for a while and she just neglected it. Okay. It could be that the tooth actually fractured, maybe for different reasons anyway. It's not paining her now.
It's not hurting her, that's
yes, but it's more like a time bomb. Okay. It could be just chronic pulpitis.
Just like that other fellow who for 20 years didn't feel anything.
Yes. Grandma is afraid because she doesn't want to lose her tooth. But I can tell her that if she goes to a dentist and she explains to the dentist, tell the dentist her fears,
okay,
they could give her other alternatives as to extracting, as removing those teeth she's worried about. But if the teeth are very bad, even I would suggest she should allow...
She should take them out. Last question in 60 seconds. Do you have to recommend a psychiatrist for some children because of the trauma in school?
Yes. It depends on what actually happened in school. Sometimes we see patients that have maybe issues of self-esteem. Sometimes it could just be a child convulsed. So we pediatric dentists always refer to the pediatric neurologist, and they take it up from there.
Okay, yes, thank you so much, Dr. Oluwo. I can't believe we spent all that time and it's gone, but we've had a great time. Thanks so much for coming. And thank you for calling. 2 grandmas in one day. I'm so blessed. Olugbon, Halima, and the last person. Thank you so much. Have a wonderful day, all of you at home. I'm Mary Alale Yusuf.